What is immunotherapy? I'm Dr. Manan Shah with Wyndly Health. Today I'm going to be talking about what immunotherapy is. So allergy medications like Claritin or Zyrtec, they'll work for a few hours, but as soon as they're out of your system, your allergy symptoms come back. Immunotherapy is the only scientifically proven method of changing your immune system for long-term allergy relief. The way we do this is we get you allergy tested, and once your physician identifies your specific allergy triggers, we give you small doses of exactly what you're allergic to over a prolonged period of time. Over time, what happens is your body actually becomes desensitized, so even when you stop taking the immunotherapy, you don't have symptoms. If you'd like to learn more, we'd love to work with you at Wyndly Health. Thanks. How do you take allergy drops? I'm Dr. Manan Shah with Wyndly Health. Allergy drops are really easy to take. You want to leave your vial somewhere where you're going to see it every day so you're reminded to be consistent. Then what you want to do is just take your appropriate prescribed amount of drops underneath your tongue and leave it there for about 1 to 2 minutes so it has time to absorb and interact with your immune cells. Then you can just swallow it. Most of the time, I tell my patients, take your drops and then either do your shaving or your combing or whatever you need to do in your morning routine, and about 2 minutes later, you swallow and you're all done. Thanks so much. How safe are allergy drops? I'm Dr. Manan Shah. I'm an ENT and allergist with Wyndly Health. Allergy drops, when taken under the supervision of a board-certified physician, are incredibly safe. In fact, the research shows they're probably safer than allergy shots. The risk of anaphylaxis, which is a life-threatening reaction with allergy drops, has been calculated to be about 1 in 100 million or 1 in a billion, depending on which research study you see. That means you're incredibly safe when you're taking your allergy drops, but it still is really important that you do it under the supervision of a board-certified physician. If you'd like to learn more, please subscribe. How long does it take before allergy drops work? I'm Dr. Manan Shah. I'm an ENT and allergist with Wyndly Health. Allergy drops are a form of immunotherapy, which is a method of changing your immune system for long-term allergy relief. But they don't work overnight. Some patients will notice benefits as early as 4 weeks, but most patients will start to notice benefits somewhere between 4 weeks and 6 months. You really want to work with your doctor to find the best dosing and protocol for you. If you have any questions, please let me know. Does immunotherapy actually work? The most commonly cited number for whether immunotherapy works is a 70 to 80% efficacy rate. And this is consistent with what I've seen in my clinical practice. In general, about 8 or 9 patients out of 10 are going to get really good results from immunotherapy, and maybe 1 or 2 patients might not. And so ultimately, I think the odds are really in your favor to try to fix your allergies. And if you work with a doctor you trust and they're focused on you, I think you have a really good chance of feeling better. Thanks. How are allergy drops or sublingual immunotherapy a more natural way of fixing your allergies? Sublingual immunotherapy or allergy drops seems like a little bit of a more natural way of fixing your allergies because instead of just taking pills and sprays to mask your symptoms, you actually expose your body to small doses of what you're allergic to until over time you become desensitized. This is a more natural way of fixing it because it lets your body fix the problem, and ultimately you can stop taking pills and sprays.